Producers everywhere have to constantly guard against bovine respiratory disease, the leading cause of economic losses in the beef industry. The lungs of cattle are very prone to infection within hours. Bovine respiratory disease, BRD for short, can cause irreversible damage to the lung tissue. 21. If untreated, BRD can result in a quick death of the affected animal or in stunted growth and reduced meat quality. BRD is triggered by infectious and environmental factors. Examples are respiratory viral infection or stressful external conditions affecting the animal's immune system. Naturally occurring bacteria in the nasopharynx normally pose no problem, but the weakening of the immune system allows them to multiply excessively, and the infection can spread into the lung. Here, tissue-resident macrophages recognize and phagocytize the bacteria. 2. As cells are destroyed, cytokines and other inflammation mediators are released, thereby furthering the inflammatory reaction. One of the enzymes activated in the surrounding tissue and immune system cells is cyclooxygenase, COX, resulting in the production of prostaglandins. The prostaglandins play a crucial role in the inflammation now developing at full speed in the tissue. Prostaglandins dilate local blood vessels, slow down the pace of the bloodstream, and increase the permeability of the vessel walls. In this way, fluid in cells of the immune system, such as neutrophils and monocytes, are drawn in large quantities to the site of the inflammation. At the same time, the presence of cytokines such as IL-1 in the bloodstream stimulates the production of prostaglandins in the brain. The hypothalamus reacts by upregulating body temperature. The immune cells drawn to the inflammation site now start producing even more cytokines and prostaglandins, thus intensifying the inflammation. The result is a self-propelling vicious cycle. Unchecked, the bacterial toxins are able to inflict severe damage on the tissue cells. The accumulating immune cells, such as neutrophils, release oxygen radicals in order to destroy the bacteria, but these radicals also worsen the tissue damage. But why is BRD such a common and important disease in cattle? Why exactly is the bovine strong so particularly vulnerable to bacterial infection? The reasons are both anatomical and physiological. Compared to the horse, the capacity of a cow's lung is much smaller. It is 1/3 that of a similar-size horse. Its oxygen needs at rest are 2.5 times higher. To satisfy basal oxygen demand, the bovine lung is used much more intensively. Other peculiarities of the bovine lung, such as a high degree of segmentation, a lack of collateral ventilation, and a large amount of connective tissue, are reducing the lung's ability to cope with invading pathogens and the resulting inflammation. Once the lung is infected, inflammation and bacterial toxins cause lesions to develop, leading to severe and often irreversible damage to functional lung tissue. The result is the appearance of the telltale symptoms of BRD, such as breathlessness, fever, loss of appetite, and depression. The economic impact of bovine respiratory disease is enormous. The performance of the affected animals is severely reduced, as measured by carcass weight and quality at slaughter. Moreover, death can result if BRD is not diagnosed in time or remains untreated. Because of the rapid progression of the disease, treatment with antibiotics alone is insufficient. The situation calls for a drug able to cope with the speed of development of BRD. Bovine respiratory disease, BRD, also known as shipping fever, is a common respiratory disease affecting cattle. It is a major concern for the livestock industry as it causes significant economic losses due to reduced productivity, increased treatment costs, and high mortality rates. In this article, we will discuss the definition, etiology, epidemiology, transmission, signs and symptoms, lesions, diagnosis, treatment, and prevention, control of BRD. Definition: BRD is a complex respiratory disease that can be caused by viral, bacterial, or fungal pathogens. It is characterized by inflammation of the lower respiratory tract and can result in bronchopneumonia or interstitial pneumonia. Etiology: BRD can be caused by a variety of pathogens, including viruses, bovine respiratory syncytial virus, BRSV, infectious bovine rhinotracheitis virus, IBV, bovine viral diarrhea virus, BDVV, bacteria, Mannheimia hemolytica, Pasteurella multocida, Histophilus, Mycoplasma, ovis, fungi, Aspergillus fumigatus, Mucor spp. Epidemiology: BRD is a common disease affecting cattle worldwide, especially in feedlot and dairy operations. The incidence of BRD is higher in the winter months due to the stressors associated with cold weather, such as increased humidity and lower air quality. The risk of BRD is also higher in animals that are transported long distances or commingled with other animals. Transmission: BRD is primarily transmitted through the inhalation of infectious droplets or aerosols from infected animals. Direct contact with infected animals, contaminated feed and water sources, or equipment can also contribute to the spread of the disease. Signs and symptoms: the clinical signs of BRD can vary depending on the severity of the infection, but commonly include coughing, nasal discharge, rapid or labored breathing, fever, depression or lethargy, decreased appetite, weight loss. Lesions: post-mortem examination of animals with BRD may reveal lesions in the lungs and bronchi, which can include consolidation of lung tissue, pleurisy, fibrinous exudates in airways, enlarged lymph nodes. Diagnosis: diagnosis of BRD is typically based on clinical signs, history, and post-mortem examination. Laboratory tests such as bacterial culture and sensitivity testing can also aid in identifying the causative agent. Treatment: treatment of BRD typically involves the use of antimicrobial drugs such as antibiotics or antifungal agents to control the bacterial or fungal infection. Supportive care, including anti-inflammatory medications, fluids, and nutrition, may also be necessary to aid in recovery. Prevention and control: prevention and control of BRD involves a combination of management practices and vaccination programs. Management practices may include reducing environmental stressors, providing adequate nutrition, and reducing exposure to infected animals. Vaccination programs may include administering vaccines against the viral and bacterial pathogens associated with BRD.